I got to visit the largest healthcare insurance company in the world. Yes, that one.
CMS?
Nice, nice. You know that I visited United Health Group. So I flew there with a bunch of other reporters, influencers. Even before I left, I asked them this, have you done anything like this before? And the answer was no. And so it dawned on me that the reason they're doing this is because they want to change the narrative. They want to change the hearts and minds of skeptical journalists, and through them, the broader American public.
Yeah, we have sort of seen, right, over the past, whatever, decade and a half, how media can be utilized, weaponized, right? So people take
Social
their
media,
information,
especially.
right, in like bite-sized formats. They follow certain people, and that person says, you know, if Joe Rogan says you're bad, then, oh my God, I believe Joe Rogan, everything he says.
I think I give United, you know, the team, the executives, and the
Yeah.
people who organized, you know, an A+ for actually
Yeah.
taking the initiative and to bring reporters in.
Yeah.
It's always a double-edged sword when you bring media in. You don't know how they're going to react. So I give them huge props for not only bringing us in, but basically allowing us to question everyone from the CEO top down to the call center agent. We got to experience all these different executives.
So you were able to go into certain doors.
Yeah, well, they opened those doors for us and we walked through them. But I think the problem is that they're focusing on the fact that there's only negative news about them, and so if they talk about themselves and their positive news, the problems are going to go away.
Calculating?
No, I mean it's naive. If you think that if you just say how good you are and all the things that you're doing is amazing, it's naive. Let's start with the positive. So we had a fireside chat with Dr. Patrick Conway, CEO of Optum, Tim Knoll, CEO of Unitedhealthcare, and there was a moderator from a former journalist, Terry Samuel, who was doing the fireside chat, and they went through, and he actually asked a question about trust. Not a softball question, but not a particularly hard question. He basically said, why should people trust you?
Right.
And it allowed both Tim Knoll and Dr. Conway to talk about the things that they're doing that they think will help them to gain trust. And so they talked about how they've lowered like hospital admissions by 18%, how they've lowered ER admissions by 11 to 12%. They're talking about by this fall, how most of the rural prior authorizations, most of them are going to go away. They talked about an internal company goal that 80% of prior auth decisions will be real time at the end of 2027. So these are goals. Some of them are achieved, some of them are planned. So I think that was, helpful. But when I actually got the chance to when they opened it up for a Q&A, I was the first person to ask the question.
I appreciate what you're doing, and it's great to have, us in here. But the reality is over the last at least year and a half, there are multiple negative headlines, right? You have patients suing you for alleged wrongful deaths. You have employees suing you for trying to cut costs and affecting patients poorly. You have states suing you for inflating Medicaid codes to get better payment. You have health systems suing you for underpaying Medicare Advantage claims. So how are you a credible messenger of this is a new United and we care about patients? Because so far the history has not been very great.
Yeah, we, commercial standing in the marketplace, and you have an industry that's complex, and you have multiple participants, health systems, care providers, patients, regulatory bodies, federal at the state level, in instances that can be incredibly nuanced. There are going to be commercial disagreements that occur. But it's concerning for us. And when there are instances where we feel like there are things we can do better, particularly on the member side, I think we, held ourselves accountable to that. Another thing we're doing on the, the trust and reputation side, because we've moved to a more transparent mindset. We published the results of our medical prior authorization programs to our website at the end of March, and literally doing something similar on the pharmacy side as well, because at the end of the day, and when you really look at how we perform on audits that are performed by all these bodies, we perform really, really well. So when you do a full and complete rendering of how we're actually performing and you get into the actual results, we do well. But I do think we need to take leave to be able to show the totality of our performance, because these one-off scenarios that you're talking about are ones that call into question, is the totality of what they're doing broken or wrong, and stepping forward and showing this information proactively builds transparency and then accountability to what they're doing. And we're comfortable with the totality of that, and we're also, when we've had to state our case, we have done well.
If these are one-off, as you suggest, why are Senators Josh Hawley and Senator Warren, two from different parties, coming together to break up big medicine? It seems like the problem is much more acute than you're describing.
Yeah, I mean, I think I stand that. There's always going to be there's always going to be commercial disagreements. There are all political beliefs, and sometimes there is consistency amongst what those are on the left and on the right side. But for us, we're working in a construct that's complex, and we conform to those rules. A lot of times, with the case of certain folks in DC, they actually don't like the rules, and that's really what they're taking issue with. It's not the conformity of entities involved in that system's ability to actually follow the rules. It's more they don't like the rules, and we play by the rules that are set. But there's sometimes a lack of lack of consistency on whether or not those in DC think that they're the right ones.
So tell me, Samir, I mean, when you hear that,
Yeah.
is that satisfactory to say that all these lawsuits that virtually every kind of stakeholder has brought against you, these are one-offs, these are commercial disagreements? I mean, is that satisfactory? Is the answer satisfactory?
Yeah, I mean, look, you framed it pretty accurately. I mean, it's incomplete.